Initiating Wellspan implementation. What will it take for medicine to follow? A framework for Wellspan medicine already exists. The harder question is whether the system that medicine has built around itself is ready to receive it. The book Wellspan, Mastering the Art of Healthy Aging, offers medicine something it rarely receives from within its own ranks: a coherent philosophical reorientation, grounded in biology and clinical experience. That redefines what the physician's work actually is in the second half of a human life. The framework is complete. The principles are stated. The vision is clear. What remains is the question that follows every serious idea in medicine: who will carry it into practice, and how? The Wellspan framework rests on two foundational claims: that health and disease are not opposites but coexisting states within one adaptive continuum, and that every disease has an optimal trajectory, a path of least biological cost along which the body can reorganize itself if guided wisely. Together, these principles do not simply refine clinical technique. They reframe the physician's fundamental purpose, not to defeat illness but to guide adaptation toward the most coherent, least destructive course available. Medicine can hear this philosophy. What it cannot yet do reliably is follow it at scale, because the systems, incentives, and training structures still point the other direction. The distance between a published framework and a changed practice is always longer than it appears. Healthcare systems still measure and reimburse cure far better than sustained equilibrium. Medical education still trains physicians primarily in the language of defeat and recovery, not guidance and reorganization. And the cultural resistance runs deep. To tell a physician that their goal is not to win but to accompany feels, to many, uncomfortably close to giving up. And yet the conditions for reception have never been better. Geriatrics and palliative care have been living fragments of this philosophy for decades. The chronic disease burden is forcing every system to confront what cure cannot do. And a generation of clinicians, burned by the gap between what medicine promises and what aging bodies allow, is actively looking for a more honest framework. Implementation will not begin with institutions. It will begin with individual physicians who recognize something true in the Wellspan framework and quietly start to use it, in how they frame a consultation, set a goal, measure a result. From there it can enter education, then departments, then systems. The book has been written. The first readers are already finding it. That is always how it starts.